Hello, I'm Dr. John Morton, and I am Chief of Bariatric and Minimally Invasive Surgery at Stanford University, and I want to welcome you to the Metabolic Bariatric Surgery Accreditation Quality Improvement Program Educational Module. So first, I want to congratulate you on taking that first step towards better health. And the second thing I want to do is congratulate you on coming to an MBSAQIP program. The MBSAQIP program has been demonstrated to reduce complications and decrease readmissions. And part of the reason for that is the program has a multidisciplinary team. It's also got several quality improvement protocols in place, and your surgeons, your entire team has a lot of experience to give to you so you have the very best success and you have the most safety out of this process. In choosing the operation, it's so important to consult with your surgeon, and together you can make the decision as to what's right for you. The other thing that's important is that many of us have tried diets in the past. And I think at this point, one thing that makes this really unique and quite important is this time it counts. This time it's going to work. This time you're going to see your weight go down and you're going to see those medical problems improve. Our number one goal at the time of surgery is your safety. The first thing we're taught in med school is first do no harm, and we take that very close to heart. We want to make sure you get the safest operation possible, and you've taken the right step in coming to an MBSAQIP program to get that safe surgery. One thing that we want to do as we prepare is to make sure that you're on the right kind of medications. And just like you're taking stock of your health concerns now, take a look at your medications. This is a good time to do an inventory of what medications you're taking. One thing that I'm happy to report is that after the surgery, you may not require any of these medications. And it is important to make sure that your healthcare team knows all about the medications that you're taking, so in the hopes that we are able to decrease them or even remove them after surgery as well. But one thing that you have to keep in mind is that your surgeon and your surgical team is committed towards making sure you have the very best safety outcome as possible. I think the key when it comes to risk management is making sure that you reduce that risk and prevent it. A stitch in time is worth 9. And what we want to make sure is that we prevent any of these problems from occurring down the road. To that mind, one way to help prevent blood clots is we will give patients massaging stockings to keep their blood flow moving. In some of the patients, we may give a blood thinner to help prevent those blood clots, but the most important thing that you can do is make sure you walk after surgery. That will help on so many different levels, everything from decreasing blood clots to improving the return of your bowel function to just plain old feeling better. And it's like anything else in life, if you follow the rules, things tend to work out for you. So it's very important that you follow the protocol that's given to you by your surgical team in order to ensure the very best success possible. The other thing that we're also aware is that even though you're having the weight loss, you're also going to have changes in some of the medical problems that are associated with obesity. Things like diabetes, high blood pressure, sleep apnea. All of those things will improve with weight loss. In fact, with some of the diseases like diabetes, you may see improvement very, very quickly to the point that there is no medication required whatsoever at the end of 1 year. In fact, we definitely see that in diabetes, where 82% of the patients no longer require medications after surgery at 1 year. And we see similarly good results when it comes to high blood pressure or high cholesterol or sleep apnea. All of those weight-related medical problems are significantly improved. There is another advantage to the surgery, and that is all the lessons that you learn around your diet, around your exercise activity, coping mechanisms, all those things that you see happen after surgery and improve. These are good lessons that are not only important for you, but also for your family members. There have been studies to demonstrate that there is secondhand weight loss, that there is secondhand improvement. You're part of an MBSAQIP program, and part of this program is a commitment to excellence, a commitment to quality improvement. And to that end, you're going to hear a lot from the program. You're going to hear from the program at the pre-op visit. At the pre-op visit, you will meet with your surgeon and the entire team to learn more about your surgery. You will have your post-op appointment made for you. You will also have your prescriptions for your surgery given to you before the surgery. All of this is to ensure a seamless transition after your surgery. The other thing that will be important is having the phone numbers to contact somebody at the clinic in case you need them, and that way you'll have them handy. While you're in the hospital, the other thing that's going to happen too is before you get discharged, you'll be asked a few questions to make sure you're ready to go home. And I think many of you will know that you're probably going to go home after 1 or 2 days, and so it's important to make sure that all those preparations are made. The other thing I wanted to mention to you is that the care that you have doesn't end with the hospital discharge. We're committed to your care long term, in particular right after surgery. You will be getting a phone call from your clinic to ask how you're doing to make sure everything is going smoothly. You need to stay hydrated after surgery, and even though you can't drink a whole lot all at once, if you sip a little bit throughout the day, it really makes a difference and keeps you hydrated. And hydration is so important on so many different levels. First of all, if you're dehydrated, you're going to feel tired, and it's important to stay with a nice energy level, so hydration will definitely help there. The other thing is good for your skin, and the last part is it makes your bowel movements more regular. Congratulations on taking this first step forward. You're going to hear a whole lot more about your pre-op preparation and all of the good things to follow. So thank you very much.
Hello, my name is Karen Schultz. I'm a clinical nurse specialist from the Cleveland Clinic. As an advanced practice nurse, I have spent the majority of my career helping patients like you who have taken this journey. It is my hope that I can share some of that experience and some tips to help your surgical journey be as safe and comfortable as possible. As you prepare for surgery, we recommend that you stop taking medications that might thin your blood. This includes over-the-counter medications such as aspirin, Advil, or Aleve. If you have a headache or a pain, Tylenol products are fine. The day before surgery, you'll generally be on clear liquids only, and then the night before surgery, nothing to eat or drink after midnight. Making the best of your stay in the hospital will make sure that you recover and return home as soon as possible. It is possible to damage your healing stomach pouch if you advance your diet too early. It's very important to stay hydrated. Sip on non-calorie beverages slowly throughout the day. To prevent blood clots after surgery, it's important to be up and walking. We recommend walking 2 to 4 hours after arrival on the patient unit. Feel free to partner with your nurse and remind her if it's been 4 hours and you haven't walked. We don't want you to sit idle for longer than about an hour. You can move your legs and your feet around in the bed. If you have a ride home from the hospital that's longer than 1 hour, we suggest you get out, walk for 5 to 10 minutes, and then continue your journey. Wear your compression stockings continuously while in the hospital, even when sitting in the chair. It's important to take deep breaths after surgery. Because of abdominal discomfort, some patients may not take as deep of breaths. To assist you in exercising your lungs, you can use the incentive spirometer. The incentive spirometer will encourage you to do deep breathing and prevent lung complications. To use the incentive spirometer properly, you take a nice deep breath in and move this plastic indicator to the center of the smiley face. I'll demonstrate that for you. Notice I held the plastic indicator in the smiley face for about 1 to 2 seconds. You want to repeat that about 10 times every hour. Preventing readmissions to the hospital after surgery is often possible by paying attention to some red flags, such as dehydration, nausea, vomiting, weakness, and medication side effects. It's very important to communicate with your healthcare team if you should note any of these red flags. It's also essential that you know when and who to call after your discharge from the hospital. The red flag warnings you should alert your surgeon about include vomiting and weakness. Inability to keep foods and fluids down is not normal. Also, if your heart rate goes over 120 beats per minute, which is 20 in 10 seconds, that might indicate some healing difficulty in your pouch. Increasing pain unrelieved by pain medication is also something you should report to your surgeon. Chest pain, increasing shortness of breath, or calf pain. Occasional leg cramps are normal. However, a pain in the back of your calf that comes and stays is something that might indicate a blood clot and should be reported. Other red flag interventions: dark urine. If your urine is dark, make sure to drink fluids. Sweet fluids may not be tolerated even if low or no calorie. Try water with lemon, decaf tea, broth, or blended soups. If you feel like you have a fever, use your incentive spirometer. Walk and monitor your temperature. If you feel like even with all of these interventions, you are still feeling weak and cannot keep enough fluids in, call your surgeon. Some patients may need to come to the hospital or clinic for IV hydration. Monitor your healing. Make sure your incision is clean and dry. Keep a light dressing on any draining incision. The drainage should be clear, pink or yellow. Green or foul-smelling drainage should be reported to your surgeon. If your incision becomes more red or swollen, notify your program. It's important to stay connected. You should receive a call 1 to 2 days after discharge. Be ready to discuss your diet and the red flag warning signs. Write your questions down so you do not forget them. When you get home, no driving until you're off the pain medication and can react to any driving situation. Continue to walk several times daily. You may also ride a stationary bike or walk at a comfortable pace on a treadmill. Gradually increase your activity as you tolerate. Save heavy lifting until after you visit your surgeon for guidance. Make sure you have your follow-up visit with your surgeon on your schedule for about 1 to 2 weeks after discharge. I wish you the best in your journey as you move forward.
Hi, I'm Nina Crowley. I'm a bariatric surgery registered dietitian nutritionist, and I work with patients in Charleston, South Carolina at the Medical University of South Carolina, where I've practiced for over 8 years. I'm here today to work with you so that you can optimize your nutrition in the early post-op weeks after you have surgery so you can stay hydrated, get in the proper nutrition, and not get readmitted to the hospital. Most programs and surgeons have their own requirements for pre-op weight loss, and they have a pre-op diet that's individualized for you. But there's some general things that you might consider. Before surgery, it's important that you maintain your weight and not gain weight. I see a lot of patients engage in Last Supper syndrome. So they're overeating before a period of knowing they're going to restrict, and we don't want that. So it's best to go light on your eating the first few days prior to surgery so that you won't have any trouble. A pre-op diet low in calories and possibly made up of mostly meal replacement protein drinks might lower your risk for complications during surgery, and it will enhance your surgeon's experience. You might be able to reduce the size of your liver, improve the surgeon's visual field, and reduce your overall operating time that you're on the table. Also, if you're a diabetic, following a low-calorie diet before surgery might improve your glycemic control, and that can help you reduce your chance of having a post-operative complication. The day after surgery, you'll be started on a staged meal progression that will begin with low-sugar, clear liquids, and it will progress through full liquids, pureed foods, and mechanically altered soft foods. A bariatric dietitian will work with your hospital to arrange the proper advancement of textures for you. It's helpful to review the stages before surgery so you can prepare by having the appropriate foods planned out for once you get home. In the first weeks at home, there's several eating behaviors I want you to work on, because when you wake up from surgery, your stomach will be smaller, but your brain doesn't know that. You will have to eat and drink very slowly so that you're able to pinpoint the exact feeling of fullness or satiety so you don't overeat. It'll be much higher up on your stomach than you're used to. Rather than that low feeling of fullness, it'll be higher in your chest. Overeating does take on a new meaning because now it might be the difference between 4 and 5 bites. 4 bites, you might feel comfortable but not hungry anymore, and 5, you might get sick. You must chew your food very well, up to 20 or 30 chews per bite, before swallowing so that you can ensure you don't get sick, and so you do recognize that full feeling. It's also really important that you drink slowly, because if you drink too fast or too much, you might feel uncomfortable. You might vomit, and of course that's not what we want. We do want you to sip on enough fluid to get at least 1.5 liters of fluid a day, which is about 50 ounces of fluids, and most people work on getting up to a goal of 64 ounces a day. This is 8 8-ounce cups, and if you factor in eating and not drinking with meals, it's about half a cup or a cup of fluid every hour. The primary goal of this first month is for you to sip, sip, sip frequently enough on fluid to stay hydrated and avoid dehydration, which is a common reason for being readmitted. Feeling weak, dizzy, and having concentrated dark urine are signs of dehydration. So if you notice these, it's important to call your team. Drink your fluids slowly, at least 30 minutes after meals to prevent these GI symptoms, and in sufficient amounts so that you can maintain adequate hydration. Avoid straws and carbonation, which might introduce too much gas into your new tiny stomach and cause discomfort. Repeated exposure to carbonation might stretch the stomach capacity or the connection between the pouch and the intestine in some surgeries. If you're dehydrated or have chronic nausea, you're actually at risk for becoming deficient in certain vitamins and minerals, particularly thiamine or vitamin B1. So be sure you're taking your vitamins as directed and talk with your team if you're not able to keep them down. In the beginning weeks after surgery, we're hoping that you're focusing mostly on staying hydrated. Then we want you to be sure you're getting in some protein when you can eat. Most patients can get their nutrition in with 3 to 6 eating occasions throughout the day. In the beginning, it's more like 6 a day, but after a few months, 3 to 4 might be adequate. Chew your food very thoroughly, as this is the first step in overall digestion, and we hope to minimize vomiting from not chewing up your food well enough. Concentrated sweets should be eliminated from the diet after all surgeries to reduce calorie intake, and we know you can't have them if you want to lose weight. But also, in most procedures, we want you to avoid the dumping syndrome, which is usually caused by food and drink emptying too quickly out of the stomach. Symptoms of dumping are diarrhea, cold sweats, fast heart rate, sweating, nausea, vomiting, or lightheadedness. The best way you can avoid this set of undesirable symptoms is to avoid foods and beverages with added sugars, eating and drinking slowly, separating eating and drinking, and avoiding alcohol. Even some drinks you might think sound healthy, like certain protein shakes, could be a source of added sugar and fat. So I'd love you to read these food labels, ask your program for a list of approved protein supplements, and talk to your dietitian. Some patients may become lactose intolerant after surgery, and they should try to switch to Lactaid milk, like Lactaid pills with dairy products, or try low-fat yogurt or cheese, which tend to be better tolerated. If you're not eating enough protein, you might feel weak, and the healing process could be hindered. So in the immediate post-op phase, even though you can eat very much, it's very important that you work on getting in bites of high-protein foods throughout the day. Your program may recommend a range of 60 to 80 grams of protein per day. To get to this goal, you might need a protein supplement to supplement your intake of lean protein from food that you can eat. Vitamin and mineral supplements are critical to optimizing your success after all bariatric procedures. Multivitamin, vitamin B12, calcium, vitamin D, iron, and B-complex are the most common supplements required for patients post-op. After about 4 to 8 weeks after surgery, most programs work on transitioning patients to a regular textured diet with a few restrictions. Working with your registered dietitian nutritionist is recommended within the first month after surgery. Foods generally recommended to avoid include added sugar, sugar-containing foods, and concentrated sweets. We know what most of these are. Carbonated beverages, fruit juice, and other sources of liquid calories, and high-fat fried foods, soft, doughy breads, pasta, rice, and some of our tougher, dried meats. Caffeine may be limited or avoided in the early phases after surgery, and alcohol is not recommended.
Hi, my name is Bishoy Luca. I'm a clinical pharmacist, and I work with surgery patients to assist them with their medication management and help them on their journey towards improved health. The medication management process starts all throughout the perioperative period. The perioperative period starts on the day right before surgery all the way through the patient's recovery time. And one of the tools that we use for medication management is called medication reconciliation. This is a process where we review all of the patient's medications before and after surgery. When we perform medication reconciliation before surgery, the surgery team sits with the patient and reviews all of their medications that they're taking at home. And this is a great time to bring in all of your medication bottles from home to review them with the surgery team. And that does not only include your prescription medication, it also includes vitamins or herbal products that you may be taking. After surgery, a second medication reconciliation takes place. This is when the surgery team will review all the new medications that you're supposed to take at home after the surgery. Now, some of the medications that you were taking before the surgery may have changed after surgery. So it's always important to remember, avoid mixing medications, mixing your older medications that you were taking before the surgery with the newer medications that you were taking after surgery. This helps us avoid something called polypharmacy. Polypharmacy is when we take too many unnecessary medications, and that can lead to side effects. Now, some patients may ask, why would my medications change after surgery? Well, there's a number of different reasons. One of them is it may be difficult to swallow large tablets or capsules for about 4 to 6 weeks after your surgery. So you may need to crush tablets in order to swallow it more easily. However, not all of the tablets or capsules can be crushed. So we may need to change some of your medications to a tablet that is okay to crush, or switch it to a chewable tablet, or switch it to the same medication that's in the liquid form. Now, some patients take different types of blood pressure medication at home. Most high blood pressure medications are stopped prior to surgery. For example, there's a class of medications called diuretics. They're also known as water pills. And the way they work is by removing water from the body. And this can cause dehydration, which is too much water removal from the body. We need to avoid these types of medications on the day of surgery. And always remember to inform your surgery team of all the medications that you're taking at home. Now, we want to spend a few minutes to talk about medications that are used to manage diabetes. If you take medications for diabetes, you should be sure to take all of your medications up to the day of surgery, with the exception of one medication, which is called metformin. We'll talk more about metformin in a few seconds. But the reason why you want to take all of your other medications on the day of surgery is to avoid high blood sugar levels on the day of surgery. Blood sugar levels that are greater than 200 to 250 can increase the risk of infection. It can also cause the wound to heal slowly. The goal is to have blood sugar levels between 100 and 200, and that is acceptable during the time around surgery. Once you're at home, your blood sugar goals would be different. So as you are leaving the hospital and going back home, be sure to also talk about all of your diabetes medications and how those would have changed after your surgery as you continue to manage your diabetes at home. And that depends on how insulin will be used for your specific needs during and after the surgery. The exception to the medications, to the oral medications that are taken for diabetes, is metformin. Metformin is a very safe and a very effective medication for managing diabetes. However, metformin should not be taken on the day of surgery. A common type of medication is Coumadin, which is also known by another name called warfarin. Coumadin helps the body dissolve clots because clots are very dangerous. But warfarin can also cause bleeding. Your surgery team will minimize all medications that can cause bleeding. It takes about 3 days for warfarin to leave the body. So the surgery team should provide a plan to you with when warfarin should be stopped and other agents that will be used instead of warfarin. Heparin is an example of a medication that can be used up until 8 hours before the surgery. So it will protect you from the clot during the surgery as well as after the surgery. So what other meds have been associated with causing bleeding? Aspirin is very common. Even baby aspirin can cause bleeding. Aspirin is also found in many combination products as well. You should always remember to stay away from anything that contains aspirin. And aspirin should be stopped for 7 days before the surgery. So it's important to always talk to your surgery team if you begin to feel pain. And you want to speak to them before that pain turns into severe pain. Severe pain also slows down the healing process. Once pain becomes too severe, it requires very high doses of pain medications. So the goal is to communicate with the surgery team once you begin to feel pain, so that way they can avoid having to use high doses of pain medications, which can lead to side effects. Now, some of the side effects of pain medications that can occur are things like drowsiness. And drowsiness can be dangerous because it can lead to patients falling within the hospital and hurting themselves. It is important to always ask for help when you're in the hospital. Everyone who's in the hospital is there to assist the patient with their needs. We want to talk a little bit about medications that are used for depression and mood disorders. Stopping these medications may not be the best thing for every patient. If you have been receiving medication for depression or mood disorders, it should not be stopped abruptly because it can cause withdrawal symptoms, which can be as dangerous as side effects. You should not stop medications for depression or mood disorders without speaking to your surgery team first. Now, sometimes patients may use medications that affect their immune function. Examples of these medications are things like prednisone or Remicade. Usually, these types of medications are stopped at least 2 months before surgery. These medications may increase your blood sugar as well as increase the risk of infections. Sometimes these medications, however, cannot be stopped all at once. Medication doses may need to be lowered slowly over a few weeks before you can completely stop the medication. So again, always consult with a doctor who prescribed this medication before stopping any medication on your own. You should always share all of your information about your medicine with your surgery team during the medication reconciliation process. That is including the prescription items that you've taken, over-the-counter items that you take, vitamin supplements, as well as herbal tea. I'd like to thank you for your time and congratulations on this surgery, and we hope that you can come to us with any type of assistance that you need throughout this journey. Thank you.
Hello, I'm Dr. David Sarwer, and I'm a professor of psychology in the departments of psychiatry and surgery at the Perelman School of Medicine at the University of Pennsylvania. One important thing to realize as you come in for bariatric surgery and get to know the bariatric team is that you're not alone in this journey. Many times patients who present for bariatric surgery assume that they're the only one who's considering or pursuing surgery at this time. Yet we see people from all walks of life on a daily basis in our program, as do many programs throughout the country. So be sure to rely on the resources of your team, but also the social support of your friends, neighbors, and family members as you go through this journey. One very important consideration to keep in mind has to do with any history of psychological or psychiatric problems that you may have. Now, many patients are often reluctant to share that history with the bariatric team, but we actually would like you to share and be as honest as possible with us about your experience with mental health treatment and mental illness. It's important for us to know what that history is so we can help support you as you go through this journey and be best prepared for surgery. Perhaps most critically in all of this is that you must be clean and sober from drugs and alcohol for 6 months, and in some cases 12 months, prior to undergoing surgery. That recommendation of 6 to 12 months may vary from program to program, but it's important that you've got those other issues under good control before you're really a viable candidate to go forward for surgery. It's also very important to believe in yourself, that what you're about to encounter with bariatric surgery is life-altering, but comes with some challenges. And while your team is in a great position to help you with that, it's critically important that you also believe in yourself and your ability to make change to experience the lifelong benefits and health that come with bariatric surgery. It's also critically important that you take your medications as prescribed, not only by your bariatric team, but also by other physicians, including external mental health professionals. Many times people who present for surgery also have a history of impulse control problems, particularly around food, that they'll often eat food in response to both negative and sometimes even positive emotions. And it's useful to begin to work with the dietitians and other team members, including the mental health professional, on those issues as you're preparing for surgery. Decline often remits and improves on its own, but is also a good time for you as a patient to think about reaching out to your program and perhaps attending a support group to get some social support. It's also important, however, that patients have realistic expectations about what bariatric surgery is going to do for their lives, not only in the long term, but also in the short term, and that patients don't expect too much too soon, particularly within the first few weeks and months of surgery. We strongly encourage patients not to use drugs or alcohol within the first few months after surgery, and if patients feel the impulse to engage in those behaviors or engage in other compulsive behaviors, to contact their bariatric surgeon and program as quickly as possible so that they can get help and treatment. There are a number of behavioral strategies that are important for patients to be aware of and help to promote success after bariatric surgery. One of the most critical ones is self-monitoring. I strongly encourage you to make sure that you get on your scale at home once a week, pay attention to what you're eating and think about writing things down, whether they be in a food diary or using something on the internet or your smartphone, and then tracking changes in your mood, particularly as they're associated with eating behavior. Getting to know these patterns can be helpful in terms of promoting long-term success. Another critically important thing is to increase your level of physical activity, and always do so only when your surgeon's cleared you for activity. We know that the more active you can become, the more successful you're going to be at losing and then controlling your weight long term. But be sure to follow your surgeon's recommendations about how to start activity and what activity is appropriate for you at any given point in time. I wish you the best of luck on your journey with bariatric surgery.